a lot of offices have some version of some sort of, we'll call it insurance warranty. And we'll talk about guarantee and warranty in a second, but they have some sort of offering for replacement if you have failure, or some sort of avenue for getting the patient made whole in some way, shape, or form. Mm-hmm. It varies between 2 years, 3 years, 5 years. Some people claim lifetime. We feel pretty strongly we're the leader in the lifetime offering, mm-hmm. but they have some sort of something. And so a big deal for the consumer, for the patient, is to sort of sort out like what's going on here. How do I know what's going to be good, and how will I be most protected? Where do I feel the most secure? And all of the things that go into that. You know, the other thing that it kind of breaks into is some people have rules that nobody else can touch their work. Right. Otherwise, you void their warranty. Right. Some people have rules where I've heard of some kind of crazy thing where, let's say it's a 5-year warranty, right? This is a couple people locally. 5-year warranty, and the implant lasted, let's say it lasted 3 years. They'll amortize, let's say it was a $10,000 procedure. Mm-hmm. They'll take that and say, well, it's about $2,000 a year worth of use. And so I'm going to charge you $6,000 instead of $10,000 to redo that. And they kind of like pit yourself against mm-hmm. yourself for the timeline. So where do we stand? Well, for years, we were 5-year warranty, no questions asked. And you were supposed to get a cleaning once a year. Mm-hmm. And we said, well, you know, we have a lot of patients from out of state, so why wouldn't we allow other people to touch them? There's not much to be broken there. Mm-hmm. So if you're from Massachusetts, why can't you get cleaned there? Right. And as long as you're getting cleaned, if you have a problem, let's fix it, right? Mm-hmm. And Erica, what is the problem with that type of what's the problem? What's the main thing we ran into when it came to that?
I would say that the main thing that we ran into when it came down to it is that patients, honestly, were not holding themselves to that standard of going locally and getting that cleaning done.
Exactly.
Sometimes they were able to do it, and they would have a really kind of tricky time finding a provider who would actually accept it, even though we are more than happy to send them there, more than happy to provide any documentation, any x-rays, any surgical notes, clinical notes to help them along that way. Some other providers didn't feel comfortable, I guess, touching that prosthesis.
Yeah. Comfortable or just didn't want to get in the mix, which is fine and understandable. Mm-hmm. Now, when that patient does that, let's say we'll just keep on Massachusetts. Mm-hmm. I went and came to see you. You're my person for a point of contact for if I have a problem. Mm-hmm. I live in Massachusetts. I went to the first year, the guy cleaned them. Second year, fine. Third year, I didn't really go in the last 18 months. But guess what? I chipped a tooth.
Oh, yeah.
I call you. What happens to done and one in that scenario?
Done and one in that scenario is essentially kind of cleaning up a disaster.
Right, because I didn't do my side, right?
Correct.
But because of the way that it works and the fact that I gave a 5-year warranty, me now being done on one, we would always end up fixing and making it whole, which is fine.
Absolutely. That patient has no idea that they have walked themselves into a disaster. Mm-hmm. It's kind of something that we know on our end.
Exactly. And so what we've done here is we've kind of walked down the trail of, at first glance, you look at a 3-year and a 5-year and you say, oh, great, as the consumer, mm-hmm. great, I'm covered. But then generally, especially in a hybrid world, it's really hard to keep and maintain that group. And there's always going to be a group of people that take it very, very seriously. Let's say a third of the people take it very seriously. They're only ever going to let us touch it. They make an excuse and come in as a vacation mm-hmm. every year. They live local. And so then they're going to get treated here every time. And those people are responsible, and they get rewarded for usually having less problems. Mm-hmm. But done in one was constantly getting pinched. We were actually, I shouldn't even just call it a done in one thing. As a specialty inside of dentistry, hybrid dentistry constantly gets pinched, and you've cost this person a lot of money. We'll say wiped their savings or cost them a lot. And so they feel like they've already paid for it, regardless of the responsibility beyond.
Absolutely.
And then the onus is on, the charge is on us to make it right. And that's fine. We did it for years. But devoid of their responsibility, right?
Yes.
And so when we were coming up with the lifetime warranty or coming up with some sort of solution that addressed that, right? The problem is mostly you're not getting any income for cleaning. You're not getting to see that patient. You're not getting to reinforce the rules and regulations. And so many of these people end up following, if you don't have a good recall program, they mainly end up falling sort of by the wayside, right? And until they have a problem, and then they come back and then they kind of get in the way, or they become a problem again. And you have to fix it, because you also don't want them to go on Facebook and say, well, I had this 5-year warranty. I'm not going to tell you that I didn't get taken care of, but now they're saying that they're not going to fix it, right? And so we, for public facing, we would always kind of fix it. So how do we fix that? Well, we kind of went back through and said, you know, if we keep people responsible, then the chance of us having a better result and having that, being able to keep that low cost is going to be beneficial for both parties, right? We're going to keep them responsible to the cleaning, and we're going to stay responsible to the teeth, right? And if properly taken care of, I have no problem insuring it and making sure that that stays long term, right? And so that's kind of where we got that from, right?